On Wellness with Wood, we're talking about testicular cancer. It's the most common cause of cancer in teens and men ages 15 to 44. Joining us is Dr. Peter Van Veldhuizen from University of Michigan Health West. Thank you, doctor, for joining us.
Thank you for having me.
So it is alarming to hear that it is the most common cancer for teens and men aged 15 to 44. There's good news in that early detection can be such a game winner in this. Talk to us about that.
Yeah, I mean, I think the recommendations are that, men in the high-risk age group do a self-examination, just like women do for breast cancer once a month. Usually it's easiest when they're in the shower because early detection is kind of the key to both curing it and limiting the treatments and getting back to life as normal.
And what are you looking for with a self-examination?
So generally the most common symptoms that show up are either pain or a mass or a lump in the testicle, or something different, something unusual.
I was surprised by this because we hear so frequently about self-breast examinations. You're saying the same thing, men need to be doing the same thing every month.
Yep.
Why do we not talk about this?
I think probably a couple different reasons. I don't think it is a sensitive topic, I think, for men, and men don't like to talk quite as much about it. It's a little less common cancer, overall, but again, cancer is not too common in that age group, but it's still the #1 cancer, and actually incidence of it is increasing to some degree in recent years.
I was going to ask, are you seeing teenagers with this?
We do see teenagers, young men as young as 15, kind of across the spectrum, even over 45. Because you're 45 doesn't mean you should stop checking, but the main kind becomes less common as we get older.
And then when there is a diagnosis, what is the treatment?
So if it's caught early, the treatment is removal of the testicle. You have 2 testicles, so it doesn't affect function or quality of life. And if it's early enough, that's the only treatment that's needed. If it's more advanced, it may require chemotherapy or other more intense treatments. Still curable, but it's a lot more to go through if it's more advanced.
Any more symptoms of testicular cancer that we need to be on the lookout for?
Occasionally blood in the urine. If it's more advanced, you may have pain or discomfort or fatigue or tiredness that go along with it.
All right. Doctor, thank you very much for joining us today on this important topic.
Thank you. Thank you for having me.
Yeah.